In celebration of the Foundation's 25th anniversary, we're hosting a series of specially themed webinars throughout the year to spark discussions about topics and issues impacting our communities in Fairfield County. As a philanthropic advisor, we manage over 570 charitable funds. As a grant maker, we've provided more than $220 million in support of the nonprofit sector. And as a community partner, we unite people and resources to address pressing needs in the 23 towns and cities in Fairfield County. Recently, we produced a community well-being index to provide the evidence and data that highlights those needs. And in partnership with our Fund for Women and Girls, the largest fund at the Foundation, we hosted a symposium on best practices in community colleges. Some of you may recognize Giving Day, which this year brought 13,000 donors together in 24 hours to donate nearly $1.5 million to nonprofit organizations. We can't do this work without the support of all our partners, donors, nonprofits, elected officials, and organizations. Together, we thrive. And now, I'm pleased to introduce our host for today's session, Tricia Hyacinth, Director, Fund for Women and Girls.
Thanks, Juanita. Good afternoon, everyone, and welcome to our August 25 on 25 webinar, which will explore the correlation between reproductive health and economic security. For more than 10 years, the Fund for Women and Girls has invested in research, promising best practices, and programs that strengthen economic security for low-income women. Although we have identified multiple strategies that get to our desired outcome of women's economic security, we do believe that access to the full range of birth control methods is key. Economic security and reproductive health access are not separate issues. Today, I am joined by Andrea Kane. Andrea is the Vice President of Policy and Strategic Partnerships at the National Campaign to Prevent Teen and Unplanned Pregnancy. For 16 years, she has led the organization's bipartisan public policy program, which includes both federal and state-level efforts, as well as developed partnerships with a variety of national organizations. The National Campaign to Prevent Teen and Unplanned Pregnancy is one of our key partners working to ensure that all people, no matter who they are, where they live, or what their economic status might be, have the power to decide if, when, and under what circumstances to get pregnant. Before we begin, I'd like to address one housekeeping matter. We'd like this webinar to be an interactive discussion, so we invite you to submit questions in the chat box that's located on the right side of your screen. Feel free to enter your questions at any time in the box. If you don't see the chat box, click on the small arrow in the top right-hand corner. Now, without further ado, let's get started. Pregnancy planning in general and the use of birth control in particular are directly linked to a wide array of benefits to not just women, but men, children, and society as a whole. Andrea, tell us how access to contraception is directly correlated to a woman's economic security.
Thank you so much, Trish, and thank you to everyone at the Foundation for this opportunity to participate in this important discussion and to contribute to the vital work that you all are already supporting in the county. In terms of your question, next slide, please. There are many complex factors that can promote or impede economic security and opportunity, but as you just said, one important one is whether women have equitable ability to decide when, if, or under what circumstances to get pregnant, and do they have the means then to act on those decisions. Being able to do so can affect their educational and employment opportunities as well as the prospect for their children, so there's really a two-generation impact. Overall, almost half of all pregnancies in the country are reported by women themselves as unplanned. That is, pregnancies that they themselves were not seeking. The good news is that after years of stalled progress, the most recent available data show a very encouraging 18% decline nationally between 2008 and 2011 in unplanned pregnancy. And that's before the gains that were made possible by the Affordable Care Act and other positive federal and state policies. And as the slide shows, very encouraging news. There were widespread improvements, with the greatest progress in unplanned pregnancy actually among poor women and women of color. But disparities remain by race, by ethnicity, and by income. And what you don't see on the chart is that the rate for poor women, you do see on the chart that the rate for poor women is still 5 times greater than for those over 200% of poverty. And what you don't see on the chart, but if we were to do a crosstab, you would see that poor women of color are at particularly high risk. So what this tells us as an organization that's very much driven by data and evidence, as I know you are, is that we still all have a lot of work to do when it comes to reducing disparities, and that's why at the national campaign, we've made health equity a priority in our efforts, and I know that equity is also a key issue for you at the Foundation and in Fairfield County. Next slide, please. So stepping back for a minute, here's a really interesting finding. The vast majority of unmarried young women say they don't want to get pregnant right now, yet half are either not using contraception at all or are using contraception inconsistently. And women in that situation account for the vast majority of all unplanned pregnancies. So the fundamental challenge that we all face is how to solve this big gap between women's intentions and their actions. And what can we all do, whether at the national level or the community level, to help people achieve the goals that they have for themselves, whether it's education, their economic goals, their family goals, and to ensure that they have the support to align their pregnancy intentions with their actions. So as we think about how to make more progress and give all women the power to decide their futures, the question is, what can we do collectively to help level the playing field around the 3 key areas that we've shown as intersecting circles on the slide? And just to go through those quickly, because I think it helps ground the discussion. The first is ensuring that all women have relevant, resonant information about sexual health, including about the full range of birth control methods, so they can pick what's best for them in their lives at any given time. The second is ensuring that all women have equitable access to high-quality contraceptive care so they can get the method of birth control that they choose. And then the third is ensuring that all women have a sense of personal agency and power, a sense that they matter, and that the decisions that they make when it comes to contraception matter in their lives. And that really means having opportunities to realize their goals. And as you can see on the graphic, these things are not standalone. They all really intersect in important ways. Next slide. I'm sorry. On to the next question.
Yes, Andrea. When considering birth control, what exactly do we mean by reasonable access? And how is Fairfield County doing in providing reasonable access to contraception?
This question really focuses on the access circle that I just mentioned, and you can go to the next slide to show what I mean. I imagine that folks listening are familiar with the concept of a food desert. Well, the national campaign has actually mapped contraceptive deserts to see whether women, and especially lower income women who rely on publicly funded clinics, have reasonable access to the full range of birth control methods. We've defined contraceptive deserts as counties where the number of public clinics offering the full range of birth control methods is not enough to meet the needs of that county's population. And we use IUDs and the implant as a proxy for the full range of birth control methods, because if a clinic offers those things, they most likely offer all methods. So what you see in this map is the yellow to red counties are places where there are no publicly funded clinics in that county providing the full range of birth control. And the redder the color, the more women live in the county with no access. The blue colors I mean, there's at least one clinic in the county that provides all methods of birth control, so that's the good news. But there's a continuum here because the darker blue represent what we call reasonable access, and that's defined as meeting the recommended ratio of at least one clinic for each 1,000 women in need of services. So the lighter blue would indicate places where there are places that are offering all methods of birth control, but maybe the ratio of women to those clinics is way above the recommended average. So now, I'm sure you want to know what Fairfield County looks like, so if you go to the next slide, we zoomed in on Fairfield County, and I really encourage folks to go to the National Campaign's website, and you can just search for contraceptive deserts, and you can scroll around and play with the data. It's kind of fun. So in terms of how things look in Fairfield County, you can see that Fairfield is light to medium blue, and what that means, the numbers behind that, are that there's about 42,000 women in need of publicly funded family planning services in the county, and in need is basically women up to 250% of the poverty level who are in reproductive age and not seeking pregnancy. And you all have 25 publicly funded clinics in the county, of which 16 provide the full range of birth control methods. So if you do the math, that equates to about one clinic offering the full range of birth control methods for every 2,600 women in need. So not quite reasonable access, but some access, which is a good starting place. However, as I'm sure you know very well, Fairfield is a large county, and even if there's decent access at the overall county level, there may well be inequities in different parts of the county or for different groups of women. So some women may have to travel very long distances. They may face transportation challenges. They may face scheduling challenges because of the hours that they have to work or the hours that a clinic is open, or they might have to come back several times for different appointments if they want a long-acting method of contraception, for example. So there's access on paper, and then there's still challenges that people face in the real world that often need to be addressed. And you can go to our website, bedsider.org, and look at our clinic finder and actually see, well, what are the clinics in your area by zip code, and what do they offer? So that's kind of the back end of these maps. We're constantly trying to keep the clinic information and the resulting maps up to date, but the information is very fluid, and we welcome input if we're missing anything. These are living, breathing documents and maps.
Of the 16 publicly funded clinics in our county offering the full range of methods, Bridgeport has the largest concentration with 7 clinics, followed by Stamford, Norwalk, and Shelton, each with 2, Danbury with 1, and Southport with 1.
That's great. It's great that you're able to look that information up in real time.
Mm-hmm. So, Andrea, as we think about our next legislative session, which begins in January, we do know and we recognize that it's imperative that we continue to advocate for women's rights, and including reproductive rights. The national campaign has developed a best practice framework that communities, states, and regions can use to guide us in our work. Can you talk a little bit about this and tell us what you believe is the best way to ensure advancements right here in Connecticut?
Absolutely, and I'm going to get to the birth control best practices framework in a second. Let me start by just sort of giving the bigger picture, if we can just go to the next slide. And as you all well know, this is a very challenging time in the health policy environment with threats and uncertainty when it comes to overall access to health care, and certainly when we're talking about access to contraception specifically. The good news is that even in this challenging environment in the last few years, many states have taken proactive, positive steps, and often bipartisan steps, to improve information about and access to contraception. That's become even more important, and I think the pace of those state-level actions has sped up as the federal policy environment has become more hostile. So the national campaign is trying to track these positive state developments and really shine a light on them, hold them up. to support folks like all of you at the community level and in many states so that you can work with your policymakers to spread the positive state policies and take even more positive steps. And there's 6 policies that we are really focusing on to improve information and access to contraception. And if you go to our state policy portal, which is shown on this slide, you'll see lots of resources and information. The good news is that Connecticut has actually adopted 3 of the policies that expand access to contraception that we focus on. And just very quickly to review, these include you've expanded Medicaid coverage for the ACA, you've adopted a Medicaid state plan amendment to provide Medicaid family planning for women who don't otherwise have access to Medicaid, and you've made it possible for women on Medicaid to get an IUD or implant immediately after giving birth, if that's what they choose. So that's wonderful, and bravo to Connecticut for that. There's some other policies that some other states have adopted that Connecticut hasn't yet adopted that you might want to take a look at and consider as you look at your legislative session. One is we're seeing a number of states requiring insurance now to cover up to a 12-month supply of birth control so that women don't have to come back to the pharmacy every month, and that helps alleviate unplanned pregnancy. The second one would be allowing pharmacists to dispense some forms of birth control directly so women don't necessarily have to go to a doctor. And then the third is codifying in state law the no copay birth control coverage in the Affordable Care Act, which, as we know, is now at some risk. While none of these policies by themselves is a panacea, together they provide more options for women and more flexibility and work toward the goal of ensuring that all women have what they need when they need it. So I'd encourage you to go to that page and you can learn even more. Now, the next slide speaks to the Better Birth Control Best Practices framework that you just mentioned, Tricia. We developed this framework because what we found is that some communities are doing really well when it comes to, say, their clinical capacity. Others are doing really well on communication campaigns and consumer education. Others might have all the policies in place, but it really helps to look at all those pieces together to figure out where your community is and where you want to go. Some policies, such as the ones I just mentioned, require legislation, but there are other policies and best practices that don't require legislation. So to help you decide where to focus your efforts, we've created what we call a Better Birth Control Best Practices framework, which is a policy and systems approach that addresses both the supply and the demand side, in other words, making sure people have access to contraception, but also making sure that they have all the information that they need to ask for and seek out the methods of birth control that are best for them. So what this best practices framework will do, and we are currently piloting it, is it'll provide communities with a central hub of resources and supports all at the same time, and it'll help communities to go through a process of assessing, prioritizing, action planning, evaluating, continuous improvement, and celebrating short and long-term gains. And it builds in a lot of community collaboration and engagement. We got fantastic input from over 50 experts in the field of reproductive health, reproductive justice, communication, policy, and evaluation to gather these best practices, and we've organized them in 5 key domains that you can see on the slide. So making sure your clinical systems, your healthcare delivery systems are doing everything they need to do to support women, making sure there's really good consumer education and communication, making sure your policies, whether legislative or administrative, are lined up. And then undergirding those things, making sure you have sort of all your what we call fundamental supports in place, your backbone organizations, your teams, your evaluation, your continuous improvement. And then as a foundation for all of that, making sure that we're going about that in a way that really addresses health equity.
Great. Thank you, Andrea. So it looks like we have a couple of questions in. At this time, I'll encourage you to take a moment and type your question in the chat box. We have 5 minutes remaining. I'll start with the first question that we have here for you, Andrea. Can you tell us a little bit about, well, someone wants to know what are some ways that people on the call who may want to get involved with the national campaign, how they'd go about doing that?
Sure. The first thing you can do is go to our website, which is www.thenationalcampaign.org, and you can access all of our information. You can sign up for all kinds of updates. We have an e-gram that comes out every 2 weeks. We have state policy updates. We have federal policy updates. So those are some quick ways that you can sort of get engaged. And I'm also, of course, happy to talk to people by phone or email as well, and make sure we can direct you to the right place. And the campaign does provide some consultation and assistance to communities who want sort of more in-depth advising and assistance.
Okay, great. Based on your research, what are some of the educational benefits that you've seen for women who have had an opportunity to access the pill earlier in life? And are there differences, are the differences the same across women of different socioeconomic statuses?
It's a great question. I think there was research done actually in the early 70s when there was sort of a natural experiment with the pill coming online in this country, but not at the same time in all places. And what that research found was that when women had access to the pill, they were able to make advancements in education and economic security and gains more than women who did not. The challenge with answering a question like that is it's really hard to do a nice randomized controlled trial where you deny some women access to those things and give other women access to the services. So we don't have a nice up-to-date research experiment that would allow us to answer that question in more recent times, but sort of the body of evidence overall is that when women have the ability to decide and control when they have children, they're able to pursue their education and economic goals. And I would just give an anecdotal example, because I heard Juanita talk about community colleges. We've done a lot of work with community colleges and often heard women say, I became a parent young. I dropped out of high school. I eventually got to a community college so I could pursue my education and get some skills to allow me to thrive and my child to thrive. And then I got pregnant again. And I was either had to drop out of school or lower my course load or change my educational trajectory. And that made it harder for me to achieve the goals that I wanted. So I think that's just a very sort of concrete example of how when women can plan either their first pregnancy or subsequent pregnancies, they're better able to stay on the trajectory that they want for them and their family.
And I think that's a great note to end on, Andrea. So as you've heard today, there is a large unmet need for contraception in the United States as well as right here in our county. And we believe it's critical that we make contraception more accessible to women who need it. If you haven't already, we ask that you call your representatives and ask them to protect access to affordable health care, including no copay birth control, as Andrea mentioned. I want to thank our special guest, Andrea Kane, and the entire team at the National Campaign for partnering with us on today's webinar and for being a champion of reproductive justice. If you'd like to follow up with Andrea after this call, please feel free to contact her via the email address provided. We also encourage you to visit our local Planned Parenthood's website to stay informed on legislation, campaigns, and elections. And lastly, we encourage you to visit us online at fccfoundation.org to read and share our recently released statement on economic security and reproductive health. This webinar will live on our website and should be posted early next week. Feel free to share it within your networks. We hope you will join us for the next 25 on 25 webinar scheduled for September 25th. Thank you for your time today and enjoy the rest of your afternoon.